Hi everyone, I'm Dr. Rachel Freeman, a senior lecturer in the social work section in the School of Allied Health Sciences at the University of Namibia. I'm currently serving as head of the Corporate Social Responsibility Program of the University of Namibia under the UNAM Cares project. It is the Corporate Social Responsibility Project of the University of Namibia under the Office of the Vice Chancellor. It is also a community engagement project which transforms the University of Namibia to be a relevant and responsive university to the needs of the society beyond the educational boundaries. Now, my aim is to introduce this video to you through our joint project on ageism under the existing institutional agreement between the University of Namibia and the University of Eastern Finland. The social sciences collaboration between the two universities in the departments of social work is relevantly new, where both the social work departments started to work on a video production in 2021, which focused on ageism and how older people are experiencing ageism in Namibia and Finland. Allow me to then express also our profound gratitude in acknowledging and thanking our funders. The funders are the Finnish University Partnership for International Development, UNIPID, as well as the FinSeal Plus Bridges Partnership Support Grant. Thank you so much for your financial support towards the production of this video. And special thanks goes to our two respected leaders, Prof. Matengu, from the Vice-Chancellor from the University of Namibia, as well as the Vice-Chancellor of the University of Eastern Finland, Rector Professor Jukka Monkonen. Thank you for your visionary leadership and your support in the internationalization of higher education and social work education. Then a big thank you also go to all the project staff from both departments of social work at the University of Namibia as well as the University of Eastern Finland, including all the stakeholders with whom we have worked so closely, who have supported us in the production of this video. And then last but not least, allow me to express our immense gratitude to all the older people, including Namibia and Finland, for sharing your valuable experiences with us. May you all remain blessed and highly favored. I thank you.
Baie keer voel 'n mens as 'n ouer persoon dat jy gediskrimineer word op jou ouderdom.
En dan kom ons ook weer hierso waar 'n mens oud jou jare, omdat jy 'n ou man is, dan sê die anders, ag, die een is toch oud. Sê dit is klaar verby. Waarvoor lewe hy nog?
Soos byvoorbeeld, as jy miskien by 'n bank kom en jy word nie kans gegee nie en jy staan nou net in die ry, as jy voor die mense kom, dan is almal haastig. Hulle voel jy wat ouer is kan wag, dat hulle wat nou na die werk toe gaan of na die skool toe gaan eers te kom, want jou ouderdom tel mos nou nie, jy is mos nou klaar van die hoe moet ek sê, van die dinge se af.
So kom dit, dat 'n mens minderwaardigheidskompleks opdoen, wat nie eens behoort te wees nie. Ons is almal mense, ons moet mekaar respekteer.
One of the issues that we are aware of, and is a long-standing issue in relation to older people, is that there are very high levels of ageism throughout many societies, that's identified discrimination on the basis of age. And that can refer to both discrimination towards older adults, but also younger people in relation to their age.
According to a report that has been done by the United Nations in 2021, ageism is a global challenge, which leads to poorer physical and mental health. It also leads to social isolation of the older persons, reduced quality of life, and it also leads to early deaths of older people.
I look at the concept of abuse through a human rights perspective, and I see that ageism actually contributes and justifies the denial of older people's human rights.
Ageism in older persons is all about the welfare of people. And the Namibian government, as a Southern African nation, has a moderately established welfare infrastructure with social workers and old age pension grant being paid to older persons. But Finland is also amongst the Nordic nations that has a very well established social welfare infrastructure as well for its citizens. And that is a commonality that I would want to draw out.
There are a number of attitudes and stereotypes about older people, including those which depict old age and older adults as being unproductive members of society because they are no longer economically benefiting the society, and also that they are in a period of decremental decline in later lives, so that the final years of life, final decades of life even, would be seen as a downward spiral to death. So older people are not seen as valuable or worthy of respect or dignity.
It seems that old people are seen as burdens in the society. When you are a bit older, in our Namibian context, you are seen as someone that cannot make decisions. Everything has to be done by your children or your great-grandchildren. You cannot make decisions. You cannot really say anything. You depend on your loved ones around you.
Elder abuse is frequently grounded in complex family relationships. Very often, the older person is subjected to elder abuse by even her favorite relationship within the family. The older person is frequently anxious about being removed from the family environment or from the community into residential care, and so will do anything to maintain their independence in the family and the community and their position within the family setup.
Elderly abuse in the country is prevalent, considering the media reports parents killed or beaten up by their children. Most of the time, they are the ones accompanying their parents to the pay point. Parents only know that they are receiving this grant, but at the end of the day, the money is ending up in the hands of their children. Grandchildren is the second largest cause of complaints falling in the domestic violence category. In 2012, the Legal Assistance Center has recorded 1 in 10 people who have applied for protection orders in Namibia. And these people were over the age of 50.
Do we have ageism? We do. It's partially very hidden, because I think it's deeply rooted in the Finnish culture. We are people who are thinking, at least I think, starting from the 90s, effectiveness and this type of economic terms of effectiveness have been the main issue. Everything has to be effective, everything has to be done very effective. And I think some consultants, they are mixing up a machine and a human person. So human person cannot ever work as a machine. But some of the goals, for example, in care of older people are set like in the industrial setting.
I have heard even nursing staff saying that some older person doesn't need this or that because she's or he is so old. And I don't understand what the age is so meaningful there, because I think that all persons, whoever what their age is, they need different things. And sometimes the nurses have said that, oh, this is so old, why is she going to the hairdresser so often, or wants to buy new clothes? What does she need?
If we talk about aging and the levels of aging, we may differentiate at least 3 different levels. One is the individual level, which is then happening there within the families and between the people, where other one is downcrowding the older people, or looking down, thinking that because of age that person is not really like fully in senses, or the last selling day was gone. And then second is the societal level and maybe institutional level, which we can see then in the institutions where people are maybe, it's very hard to say abused, but let's say that they are very badly cared in some places. And the rules are not starting from the needs of older people, but they start from the needs of administration, or they are following the needs and norms given by the politicians or higher level decision makings, where again there is beautiful talking about the good care and quality, but in any case behind everything is cost saving, cost consciousness and effectiveness. And then we come to the societal level, and there we can see in the legislation, there are some legislation which is narrowing down the older people's rights to some benefits, for example, or not benefits maybe, but some rights when they are after they are 65, which is this old-fashioned understanding of old age. It's from Bismarck, Germany, not anymore proper for this current societies who are living the longevity period. Then there is this, I also consider this scarce financing of care of older people as ageism and abuse of older people. Not enough financing to the care means not enough personnel, not enough care places, not enough home care. And there is a certain amount, every fifth maybe, of the oldest old, usually women, who are living in low pensions. Low in the Finnish societal terms, so relatively low.
In the COVID-19 pandemic, what we have seen across many countries is that older adults were specifically and very quickly identified as one of the key groups of individuals who might be more at risk from the virus, and who might be more at risk of specifically at risk of adverse consequences and even death. And in that context, what happened in a number of situations and in a number of different countries was that older adults were very quickly determined to be withdrawn from wider populations.
It is really clear from the impact of COVID-19 that older people are among those most directly at risk of COVID-19 related illnesses that might also lead to death among the older persons. We find also that the impact of COVID-19 and the responses to it really presents critical challenges for older people. And it also affects not only their health, but also their mental health and well-being, as well as their dignity and their rights. And this is especially true for those older people who have already experienced a lifetime of poverty, exclusion, as well as inequality.
Measures such as social isolation was especially emphasized, especially for older persons, that they should isolate themselves and not be in social contacts with others. But for an older person not to be in contact with his or loved ones, children and grandchildren, also contributes to the emotional suffering of older persons. And emotional well-being is as much important as is physical well-being. And if a person is suffering emotionally, their immune system might also be affected and they might also then suffer harm. So those measures of social isolation, which was put in place, may have also contributed in one way or another to the older person suffering.
Gedurende die pandemie van COVID-19, regtig ons as ouer mense het baie bang gevoel.
Party keer voel ek ook bang. Die mense het so gesterwe met die COVID-19. Dan het ek masker opgesit. Dan gaan denk ek later weer. Hy, sal ek dit nie opdoen nie. Dat ek my liefs vir my onttrek, maar dan voel ek is verplig. Wees bly met die wat bly is en treur met die wat treur. Dan kom ek gaan, God sal alles voorsien. Alles is nie verniet, die Here is in beheer.
As a community, in African communities, we are very much collective, of believing in collectivism and being together. And that practicing of collectivism is also where our older persons are taking the lead in community meetings to guide and to support and to give advice. And once again, during the time of COVID-19, older persons may have had difficulties to take that lead to convene in meetings and providing guidance in times of difficulties or joyous moments such as weddings. But we learned that those events where people are gathering in big numbers were the super spreaders of the COVID-19 pandemic. And somehow our older persons have suffered going there, or suffered also when they leave the community at large unattended and not responding to issues as leaders.
The Finnish decision makers, high-level politicians, they asked the people 70 plus to stay at home and not go out from there, not move anywhere, not meet their relatives and so on. I have been criticizing this all the time. I guess that it was a move which was a decision and suggestion which was done because that was a totally new pandemic and people didn't know how to deal with that. And many took that recommendation as a a regulation, so they really didn't move. They were lonely and they didn't go anywhere. And we have in the research we see that the loneliness among older people living alone has been increasing.
Meidän on kaikkein kultaisin, sanomatta se joskus jää. Keittää lämpimän kaakaon iltaisin, uuteen aamuun taas herättää. Keittää lämpimän kaakaon iltaisin.
There is also quite recent research that personnel in the healthcare, they have quite negative attitudes toward older people, probably thinking that they are so time-consuming and a lot of problems and too many issues, health issues there. Usually the primary care is tuned that way that you should have only one problem when you go there to the doctor. If you go with 2 or 3, you are already considered as a difficult case. Maybe that was too heavy to say, but I think that this is the case and I have myself some own experiences of that too, even I'm not yet so awfully old.
Older people have been stereotyped in public discourse as well as on social media. And in some contexts, for example, one would find that age has been used as the sole criterion for access to medical care.
And it also happens that we did not have space in the hospitals. Most health facilities did not have space. And sometimes if it happens that when a younger person comes in with COVID and there is an older person over the age of 70, 80, more privilege were given to a younger person. which I think maybe they were thinking of, this one has still life before then the one who is 80, 70, 60 years old. We also have a huge shortage of oxygen during May, June 2021. And it caused that we have lost lives. Decisions made by health professionals for greater good to take sick patients, mostly older patients, off the oxygen to save or to supply for patients who is more likely to survive.
In some situations, there was almost a sense that through the course of the pandemic, it was probably okay if older people died, and that older people had lived their lives and had, in a sense, run their course as individuals, and that younger individuals should be prioritized for treatment and care.
As been said during the time of COVID, and when it comes to the health institutions, most of the time, due to the overcrowdedness that we have already mentioned, family members feared for the life of their older person, and they tried to keep them even at home. And the older person were also so fearful that they most of the time feel like it's better to stay at home rather going to a health institution, because everyone, most of the old people going to institutions don't make it. So most of older people also succumbed of COVID due to the fear they had, because seeing that my colleague, my loved one, my sister, my brother who went to an institution to be assisted did not make it. So it's better for me to stay at home and to be treated at home. That also caused most older people to succumb of COVID-19 during the third wave.
I know that there have been problems in the terminal care, that people, because relatives were forbidden to come to visit the institutions, that also people in the terminal care had to have their last moments and days just alone in their rooms. And of course this that people were denied of visits of their relatives had a very bad psychological impacts on the life quality of those older people living in institutions.
Our Namibian government is a state party to the Madrid International Plan of Action on Aging. They signed that international document committing themselves to promote the well-being of older persons. And we also have another continental document on the African Union, the AU, have an African Plan of Action and Framework of Older Persons, which our Namibian government have also supported. However, national legislation on older persons, we're falling behind. The law that is in place at this current moment is the Aged Persons Act of the year 1967, which was adopted during the independence because it was drafted during the colonial rule. And that legislation only talks about older persons in institutional care, older persons living in old age homes. And the number of older persons in Namibia living in old age homes is less than 2%. So that legislation does not provide for the many older persons living in the communities, being taken care of by their communities. And there are people who need long-term care and frail care, and we need policies around that. And when we look at older persons living in the family care setting, what is the care that families are providing to older persons? Very little is written about it.
Thinking about the legislation, I think that we are in need of some updating. I think that the general legislation for everybody's right of good health care and social services, in fact, it is good that if the municipalities would follow that, and let's see what the new social and health region will do. But I think that the problem is that those general framework legislations are not followed up. To strengthen the rights of the older people, I think that we should get to the legislation the right of older people to get the need and help they are needing. We should also update the legislation in the rehabilitation services, and there should not be any age limits in the rehabilitation. The limits should be only medical.
The Universal Declaration of Human Rights, which was introduced by the United Nations at the United Nations in 1948, actually didn't contain anything specifically through its articles in incorporation about the needs of older people. Age was not mentioned, so the document as it stands applies to all adults.
Regarding the United Nations or International Convention of the Rights of Older People, earlier I was against that because I thought that it's a strange world that every group has to have their own convention. The children, the youngsters, everybody has to have their own convention. I thought that to whom this society then is if every group has to have this type of convention. Nowadays, I think differently. I think that we need the convention. We need the International Convention of Rights of the Older People in different societies, and we need this strengthening of rights of older people to the care and services they need.
There are United Nations conventions for children as a vulnerable population, promoting the rights of children, and there are also a United Nations convention for women, promoting the rights of women as a vulnerable group, and the United Nations Convention for people with disabilities. I do not say that all older persons are vulnerable, but there are a big number of them who are vulnerable, and because of age, they may be vulnerable. And therefore, the need to also consider globally a United Nations Convention for older persons.
I'm waiting for that there is some type of wake up. And sometimes I think that maybe it's because people know very well of these problems in the care of older people in Finland. But maybe people don't want to think about that. They don't want to, and we don't want to think that this is our future because it's somewhere far away. And I don't know, I'm waiting for some type of societal wake up with this and understanding of what is to live in a society with longevity.
Maybe I have even sometimes heard that they have said that if I just want to die, I have nothing else here anymore. But then of course many people who can act themselves without a bigger help, or those who can have enough help in their everyday practice, I think they can be very eager to live more, and so they can have hope and wishes and dreams like the younger people do.
Tois muistot lapsuuden, äiti muutu ei milloinkaan. Lohdutusta joskus jos tarvitsen, silloin saapua kotiin saan. Lohdutusta joskus jos tarvitsen, silloin saapua kotiin saan.